The DuPage County Health Department has been on a continuous journey, building an infrastructure to support key components of an ideal crisis center. I'm walking on the grounds of what will complete the next steps of this crucial journey, DuPage County's Crisis Recovery Center. The journey to wellness begins here. DuPage County Health Department is a leader in public health, providing high-quality mental health care services to those who need help the most. Behavioral health is a core public health function at the DuPage County Health Department. The new Crisis Recovery Center, an immediate care triage behavioral health center, will revolutionize the way crisis services are delivered in DuPage County, offering an integrated approach to addressing the mental health and substance use treatment needs of individuals in crisis. DuPage County Health Department aims to provide gold-class support during critical periods of distress.
Our job is to protect the health of the nearly 1 million residents of DuPage County. We work at the population health level, really that public health lens, so looking at the health of the community as a whole is sort of our first responsibility. From there, we then also assess the gaps in the healthcare system and what is making people less healthy, and so then what do we do about it? We take action on that. And so we provide direct services and clinical care, absolutely for mental health and substance use, but also for moms and babies, young families. We have a dental clinic. We do a lot of different direct care services to our community when we assess that not everybody is having the access that they should.
Well, you know, it's interesting because some people have an attitude about folks that are in the system, right? Well, we can't do anything about that. And my answer to that is we failed them. So it's our responsibility to support them and help them. And we don't give up on people here in DuPage. You know, I mean, we do everything we can, and now we won't have to send them to jail. We won't have to send them to an ER where they may sit for a very long period of time, get sent home, and come right back 6-7 days later.
The biggest gap we're trying to fill is in the access to care for behavioral health crisis needs. That's our primary focus right now. We know that individuals experiencing a behavioral health crisis have too few options. And so oftentimes what we find when a community member is in a moment of crisis, they're ending up either in the emergency room and waiting for a more appropriate level of care, or they're ending up interacting with the justice system in its various forms. And those are not good outcomes for anybody. It's not the right type of care, nor is it the right use of community resources to deal with that situation. So that's the biggest gap that we're focused on today.
So our Crisis Recovery Center is really a completion of our system of care for crisis services. So really will allow our residents to have someone to call, someone to respond, and our Crisis Recovery Center is the new somewhere to go. And the Crisis Recovery Center will really change the way that crisis care is received in our county. So if it's a medical emergency, they should use 911. They should go to the emergency room. That's what those services are dedicated for. If it's a mental health or substance use emergency, then utilizing the services that are available for crisis, such as 988, our mobile crisis response, and soon to be the CRC. This will have that one place to go to be able to receive the right care from mental health and substance use professionals, as well as people with lived experience, to help them kind of get through that situation and link them to ongoing care.
988 is really intended to be for any type of emotional distress. So those examples could be somebody really having a rough day, feeling alone, having depression, having an anxiety moment, being under the influence. You know, substance use crisis is a reason to call. And of course there are calls to 988 where someone is actually having a suicidal thought. That's a very appropriate time to call, and it really allows that opportunity for that individual to get clinical support, and really just that emotional support from a warm person on the other end of the phone. We also have someone to respond. So when individuals need a response in the community, we're able to send out a mobile crisis response team, and we have a 12-bed adult crisis residential unit here on the property. The goal of any of our interventions is to really connect that individual with what they need. So sometimes that is for our adult population that might come in the building, that might be to stay in our crisis residential. And so folks might be able to stay up to 5 to 7 days, but more often than not, individuals receive support, receive some referrals, and then they are going back to their typical home environment.
It's coming into a nice, warm, inviting place to have that evaluation completed and really determine what they need. It really takes the responsibility off the person that's struggling and allows us to really hold their hand through this, really be able to assist. And so that really then kind of puts them on a different path to recovery.
Our building here is going to have no wrong door. And what that means is that individuals, if they are here, they're in the right place.
So we approach this with an idea of having something that's a little bit more human scaled, a little bit more inviting space so that people feel comfortable walking into the building. That's kind of first and foremost. Then once you get inside the building, we really focused on biophilic design. It's an approach that connects people with nature. There's a lot of studies out there that have shown that connections to nature can really help support people's recovery, health, and well-being. What better project type to connect this to than the Health Department's Crisis Recovery Center? So we spent a lot of time working with the health department to understand exactly what they were trying to accomplish in terms of the care in the facility, even things like touring other locations. There are a handful of other locations around the country who have done facilities that are similar. It's a real partnership, and for us, we can't just go away and work in a vacuum and just drop out a perfect design. It's really got to be tied closely with, what are the mission, what's the goals, how's it going to operate by our clients. And in this case, the health department did a great job of really walking us through what they were trying to accomplish. And through the research we conducted together, I think we're coming up with a really great facility design.
We have the finances to build the building. It started with a $5 million grant from the state of Illinois. The county board has also allocated from ARPA funds over $20 million for building the building. We've got $1 million from the federal government through Representative Caston. We've got the money to build it. Now we're going to have to figure out, and we've got a plan to operate it over the course of time. Some of that's going to come from insurance, non-insurance, Medicaid, various other places. There really isn't or aren't too many places, if any, that are going to be like this, and certainly nothing to the extent that we're going to have. Not only because of the physical plant and the people who are going to staff it and the experts that we're going to have, but the money and the time and the expertise that we're going to have, as well as the cooperation from all of the stakeholders. I mean, we've got everyone involved in this, from people in the court system, fire departments, police departments, hospital emergency departments. There's no one who doesn't think this is a great idea.
We have a moment in time now, and with this facility, we can really make some differences.
The CRC is the next critical step for the DuPage County Health Department's journey to build a gold standard behavioral health system to ensure that all DuPage County residents have someone to call, someone to respond, and somewhere to go.